Good morning, everyone, and welcome to our ECC webinar, which is hosted by the ECC Programme Office for Cavan, Donegal, Leitrim, Monaghan and Sligo. My name is Orla Gilchrist and I am the ECC Project Support Person within the team, and I'll be your MC for the webinar today. With me are Lynn Stoddard, who has taken on the role of General Manager for the ECC programme, Ciara Kane, who will shortly be joining our team as Programme Administrator, and Ciara Rooney and Christine Campbell, who will be our presenters today. Ciara Rooney has recently taken up the role of ECC HR support for the ECC programme and will be providing her HR expertise on this webinar. Christine Campbell is the CHO1 Payable Manager and will be providing her expertise from the Payable perspective. We will be hosting a number of webinars over the coming months. The aim of our webinars is to highlight the objectives of the enhanced community care programmes in CDLMS and to provide knowledge, guidance and supports to those of you who will be setting up and working within these programmes. This is our first hosted webinar and we will be focusing on HR processes and documentation. So today we are going to cover a number of topics, including HR forms, the recruitment gateway, job orders and position numbers. So before we get started, just a few housekeeping points to note for today's webinar. Today's event is being recorded and this recording will be available to view on the Community Healthcare YouTube channel after the event. If you have registered for the webinar using your email address, you will be sent a link to the recording once it has been added to the channel. Please note that the video will only record the panelists on screen and not the audience members or the chat feed. And for our audience attendees, you will notice that your audio and video is turned off. This is to assist us in managing the online event a little more smoothly. We will have a Q&A section at the end of the webinar, and during the webinar, you can put your questions into the chat box, which is on the bottom left of your screen, for answering at the end of the webinar. Please note that our focus will be on questions around the general processes and not specific to individual services. An FAQ document will be produced following today's session, and as we might not have time today to address every query that's raised, we will be circulating the FAQ document in the coming weeks. If you have any technical issues or questions during the event, please do post a message to host in the chat box on the bottom right, and we will do our best to respond to your comments and queries. And finally, we will be doing a short poll at the end of the Q&A session, which will just take a few minutes of your time, and it will really help us to inform future webinars that we will hope to be hosting. So without any further delay, I'm going to hand over to Lynn Stoddard, who is the ECC General Manager, to give us an overview of the ECC programme. So over to you, Lynn, to commence this afternoon session.
Okay, thank you, Orla, and welcome everybody. It is great to see so many people registered, so it just identifies that there was a need and an interest certainly in this topic. We look forward to working with you and supporting you over the coming months and years as we work together on this significant and exciting healthcare transformation programme that is ECC. So I suppose the ECC programme, as we know, is part of the Sláintecare Reform, and that's really about delivering the right care in the right place at the right time. And this is real investment in our community services, and for CHO1 it results in over 380 new posts. So the programme initially just has three components. There's the implementation of community healthcare networks, and there's 8 across our area, 4 in Donegal, Sligo, Leitrim, Cavan and Monaghan. We'll be establishing community-based integrated specialist teams for chronic disease management, focusing initially on diabetes, respiratory and cardiology. And we will be working very closely with our GPs and our acute hospital colleagues in setting up these integrated services. We're also establishing ambulatory care hubs for older people, and this is really to enable them to remain living in their own home and community supported. And certainly we have a long history in the Northwest in particular of maintaining older people in their own homes, with the lowest number of people in long-term care, certainly in the Donegal area compared to national. So this programme includes care for frailty, there's falls prevention, reablement, dementia, memory assessment and complex case management. And there's integrated frailty at the front door teams based in the ED departments in each of our 3 aligned acute hospitals, that being Letterkenny, Sligo and Cavan General. So really the programme is designed to create equity of access for our population. So it's a population health approach with a focus on prevention and health promotion. And it's for those requiring low-level care in primary care delivered by our primary care teams and networks, those who need specialist care for chronic conditions and conditions of old age, where they can be managed in the community and they don't require hospitalisation. If they do require hospitalisation, it is about supporting them to get home sooner. So the programme will meet the needs of service users, their communities outside of the acute setting, and this will help reduce the demands on the acute services. So these new teams will work together, connecting care pathways that step up from GPs and primary care teams to the acute setting and back into the community, and always following the patient journey with a patient-centred approach. I'm delighted to have recently taken up the post of GM and ECC, and really excited to get the team established with Orla and Kira, and the two Kiras I should say, and we're indebted to Christine for her expertise as we've been progressing all these posts over the past number of weeks, and to many of you on the call who have been on that journey with us. And with that number of posts, obviously there's backfill, so there's a lot of HR processes that need to be followed. So as in my role, I'm responsible for overseeing and coordinating the planning, implementation and reporting of this programme, and working closely with and supporting senior managers in both the acute and community settings. We really look forward to working and supporting you to successful delivery of this programme, and thereby improve the care for our service users and our population in this area. So I'll hand you back to Orla now for the next piece of the webinar. Thank you.
Thank you very much, Lynn, for that overview of the ECC programme and the ECC programme office. So we'll now begin our first topic, which will cover introduction to hire forms, job orders, and the temporary appointments to a higher capacity process. So during the presentation, a little reminder that you can put your questions into the chat box for discussion at the end of the full session. And once more, I'd like to remind you that this webinar is being recorded. So I'll now hand over to Christine, who will present on hire forms and the Payable pathway. Thank you.
Hello everyone, and you're very welcome. So I will give you an introduction to the hire forms. So a hire form is the document that is used to make an application to hire or recruit a new member of staff. There are 4 types of hire forms: a hire form A and a hire form B, which are used for posts up to grade 8. For management posts grade 8 and above, they require hire forms A1 and B1, which can also be called an Appendix 1, which is an A1, and an Appendix 2, which is a B1. A hire form A is required for all new posts created to address changes to service delivery, which may be through the suppression of an existing post or through a budget reassignment. A hire form B is required for all replacement posts, such as, for example, retirements, maternity leave, career breaks, etc. These positions will have an existing budget attached. These posts are like-for-like replacements and will not impact on the budget or the WTE rate. As stated on the hire form B, a position may be replaced at a lower grade but cannot be replaced at a higher grade. An approved hire form is required for each individual post, and it is the official approval document for the recruitment process. So the hire form that you can see, this is the new version of the hire form which has recently been circulated. Services may be more familiar with the old version, which is at the minute still accepted by Payable and HR departments. The next slide outlines the forms that should accompany the hire form, which are the job order form, a pre-placement health assessment form, and a business case. 4 forms in total in the suite. The job order forms are required by the HR departments in order to have specific information in relation to the post. This allows them to provide essential information to candidates when expressing posts to the panels. The job order contains information on the base of the post, the WTE required, the contract type, panel information, manager's details, if the post is permanent or temporary, etc. As per the slide, there are a number of job orders which are specific to the grade of staff. There are job orders for nursing grades, management admin, health and social care professionals, occupational therapists, physiotherapists, speech and language therapists, psychologists, medical dental staff and support staff. The next form required is the pre-placement health assessment form. This form is required by the Occupational Health Department in order to assess the candidate and deem them medically fit for the role accepted. The service manager is only required to complete section 1 and 2, which is usually the first page of this form. The fourth document required is the business case. The business case is required by management in order to make an informed decision when reviewing the post. The business case should include details such as the impact on the service of not filling the post, the cost implications, if any, the WTE value, etc. Business cases are vitally important when submitting hire Form A's, as they are cost increasing and WTE increasing. It should provide specific information on why the post is required, how it has been funded, and details on the impact of not filling the post on the service. The decision to approve or decline the post will be made based on the information provided in this document. And all of these forms can be found on the HSE website. I will now pass you back to Orla.
Thank you very much, Christine, for that very comprehensive overview. I'm now going to hand over to Ciara Rooney, who is going to take us through the temporary appointments form.
Thank you, Orla. We'll now take a look at temporary appointments in a higher capacity. The temporary appointments form is also referred to as an Appendix 1 form, and as the name suggests, it's used for processing temporary appointments in a higher capacity. An approval request for a temporary appointment should only arise where an approved position has been returned from the recruitment department as unable to fill, or where the recruitment department has confirmed that there's no suitable live panel in place. All temporary appointments to a higher capacity must follow the Payable pathway. This means they require approval from the Chief Officer. Once approval has been received by the service manager from the Payable office, the candidate can be appointed to their temporary role. For clarity, a temporary appointment in a higher capacity can only be offered in cases where there is an urgent service need and the service is unable to fill the position due to the absence of a panel being in place or returned as unable to fill. In these circumstances, the temporary appointment allows time for the service manager to follow the recruitment process to fill the permanent vacancy without the vacancy having an adverse effect on the service. Where a new campaign to fill a position is required, this can take 3 to 6 months from advertisement to start date agreed. The appointment must be between 3 to 12 months duration. If 12 months is exceeded, the manager must review the position and seek further approval to extend the temporary appointment as appropriate. Along with the temporary appointments form, an Appendix 1, business case and checklist must be submitted as a full suite of forms following the Payable approval process. Form Bs are not required in this instance, as a Form B should have already been submitted by the service manager seeking approval to initiate the recruitment process for the permanent position. I will now hand you back to our host, Orla.
Thank you, Ciara, and thank you, Christine, for that very comprehensive overview of hire forms, job orders, and temporary appointments. Just a reminder that we are recording today's webinar and that the recording will be available in the coming weeks. In relation to the Q&A session, if you have any questions in relation to the topics that we're covering today, please type your question in the chat box, which is on the bottom right of your WebEx screen. We're now going to move on to topic 2, which will cover the Payable pathway, the primary notification process, and the organisational management forms OM1 and OM2. So over to you, Christine.
So the CHO1 Payable pathway, which is the approval process for all hire forms and Appendix 1's temporary appointments. The Payable pathway and approval process is a pathway that has been agreed by the Chief Officer and the Head of HR to manage and monitor appointments in the CHO1 area. Hire forms are created by the Service Manager and progress through the management structure for approval. The Service Manager progresses the application to the General Manager to review. If approved, it will be forwarded to the Head of Service for consideration. Once approved by the Head of Service will forward the documentation to the Payable Department where it is logged and checked to ensure that all the details are correct, and the details that will be checked are, for example, the position number, the grade code, the last person in post, is it permanent or temporary, etc. When the form has been checked by the Payable Department, it is progressed to the Chief Officer for approval. When the form is approved by the Chief Officer, the Payable Department will progress it to the relevant HR department to commence the recruitment process. The Payable Department issues a monthly update report on approvals to the Heads of Service and General Managers. Hire Forms A1 and B1 require additional approval in order to proceed. These forms must receive the approval of the Director of Community Operations for Hire Form B1s, and Hire Form A1s will also need the approval of the Department of Health. The Strategic Workforce Planning Authority will then issue the approval through a log number or primary notification. All temporary appointments in a higher capacity must also follow the Payable pathway. That brings us to the primary notification process. The primary notification is the national approval for new development posts. It is issued by the Strategic Workforce Planning Authority, which is part of the National HR Office. Multiple posts can be approved under a single primary notification. Posts are uniquely identified by SWPA log numbers. The primary notification outlines the details of the posts approved, including the title, the grade code, etc. The Chief Officer, the Head of Service, and Payable Management are notified when the primary notification is issued. Some primary notifications will have the allocated area outlined, while others will not. In this case, the Head of Service will review and allocate the post to a particular area, which for CHO1 will be Donegal, Sligo, Leitrim or Cavan, Monaghan. Once the post has been allocated to an area, the service managers are required to submit a job order and a pre-placement form to the Payable Department, where it is logged and tracked for reporting purposes. The primary notification and SWPA log number should be clearly detailed in the section provided on the job order form. A primary notification does not require a Hire Form A. The Payable Department will progress to the relevant Recruitment Department. That brings us to the organisational management forms. So there are two types of forms: an OM1 form, which is used to create or maintain a position number, and an OM2 form, which is used to create or maintain an organisational unit. The OM1 form is to be completed by the service manager when a new position needs to be created in SAP. There should be an approved Hire Form A or a primary notification in place. The service manager should complete Section A of the form to request a new position number. When an existing position number needs to be maintained in SAP, this may occur if the post is moving location or changing cost centre or being regraded, for example, to an enhanced nurse grade. The service manager needs to complete Section B of the form. Just to note also, the position number is not attached to a person. The position number is attached to the post, the grade, the org unit and the cost centre, which are all linked to the position number in the background on the SAP system. In the North East area, which is Cavan, Monaghan, they do not use the OM1 or the OM2 forms. Service managers send an email to the HR department requesting the position number and advising them of the Payable reference or the NRS reference code attached to the new position required. OM1 forms can be submitted along with the Hire Form A or the job order at the initial stages, or they can be created and submitted to CHO1OM@hsc.ie when the candidate has agreed a start date. It is important to ensure that all required fields are provided on the form. Details are often missing, for example, the start date or the org unit number. I am unable to action the request if these details are not provided. The OM2 forms. These forms are to be completed by the service manager when a new organisational unit is required. For example, a new initiative is being rolled out or a new development is being set up. An org unit will have a master org unit and will have a cost centre attached at setup. All staff employed under the specific initiative or department will sit in the org unit and will automatically report to the correct line manager on NISRIP. It is important that all line managers familiarise themselves with the org unit numbers and position numbers under their remit. This will allow them to have a clean organisational structure with all position numbers and therefore staff being located, costed and reporting to the correct line manager. The OM1 forms is to be approved by the General Manager. All OM forms can be found on the HSE website. I will now hand you back to our host Orla. Thank you.
Thank you, Christine, for that very interesting presentation on the primary notification process, job orders, and the organisational management forms. We're now going to move on to topic 3, which will cover the HR setup forms, HR 101, HR 102, HR 103, and forms HR 3 and HR 106. So I'll hand over to Ciara Rooney now, who will present for us on this topic.
Thank you, Orla. We'll now take a look at HR setup forms for new employees, existing employees who may be changing grade, location, or changing their contractual terms. Local HR departments are responsible for processing HR forms. Therefore, all recruitment forms must be returned to local HR departments for further processing. Service managers concerned about delays in processing of employee HR forms can contact their local HR department for further updates. The pathway for HR forms in the North East and the North West are different. All SAP actions such as hiring, rehiring, promotion for the North East are conducted by National Personnel Records and Merchants Key, also known as NPR. SAP actions in the North West are carried out by local HR departments. All forms must be submitted to the HR department for further processing. HR 101. A HR 101 is required for all new starters in the HSE. If as a service manager you're unsure whether to use this form, remember if the person has never worked in the HSE before, you use the HR 101 in place of the other higher forms we will discuss today. Please note that delays in submitting higher forms can have an adverse effect on employees' pay. Line managers will always be required and requested to sign these forms and return them to their HR department. An employee personnel number will not be issued until confirmation of the actual start date of the employee is received by NPR from the HR department. It's therefore crucial that service managers communicate to the local HR department the start date so that the employee can be set up with a personnel number. The personnel number is needed for everything from travel setup to email addresses and all IT equipment. A HR 102 is required if there is a change to an existing employee's terms and conditions. For example of this, it would be a change to contracted hours, a permanent promotion, or transfers to another location within the payroll area. It is important again that this is done in a timely manner by the service manager, as delays can adversely affect an employee's pay. A 102 is only to be used when there is a permanent change to an employee's terms and conditions, and the employee will remain in the same payroll area. A HR 103 is used in all instances for temporary appointments within the HSE, including temporary appointments to a higher capacity and grade-to-grade temporary appointments. For example, a clerical officer who took up a temporary contract in a test centre was successful at a skills match meeting and has now taken up another temporary clerical officer role will be required to complete the HR 103 to extend the employee's current contract and put them into their new temporary position. Likewise, if a grade 5 is given an acting grade to a 6 for a period of longer than 3 months, the 103 is the appropriate form to use. The 103 cannot be used for any other purpose, such as permanent promotions or a move from a temporary to a permanent contract, as the HR 103 requires an end date. A HR 3 is required when an employee is moving from one payroll area to another. If an employee currently is based in Cavan, for example, and temporarily takes up a role in Sligo, a HR 3 is required for payroll and SAP purposes. The payroll in their old or current area and the payroll in the new area must complete the relevant sections of this form. This is important to ensure continuity of pay and pension contributions. Partially filled forms will not be accepted for processing and can delay the employee's pay. The HR 3 will be processed again by your local HR and NPR. A HR 106 is required if an employee is permanently transferred from one payroll area to another. Managers must use both forms, which is the HR 3 and the HR 106, to ensure their old payroll area and new payroll area are aware of the permanent move. Taking this action will reduce the risk of an overpayment occurring to the employee. Where an overpayment occurs, repayment plans must be put in place between the employee and the payroll department to recoup monies paid in error. This is a complex process and can easily be avoided by the timely return of the 106 form along with the HR3 form. Thank you, and I'll hand you back to Orla.
Thank you very much, Ciara, for that clear and informative overview of HR setup forms and their appropriate use. We're now going to move on to our fourth and final topic, which will cover the new recruitment gateway, which is currently in progress. So I'm going to hand over to Christine Campbell now to give our attendees an overview of this final topic. Thank you, Christine.
Thank you, Orla. So I just want to give you a brief overview of the an introduction to the recruitment gateway, which is coming down the line. The Recruitment Gateway is an online portal being developed at the minute for the creation of job order forms only. This portal will give the requesting manager full view of the progression of the job order from its creation right through to the end process. This portal is for job orders only, and services will be able to attach a hire form, a business case and a pre-placement health assessment form to the portal. The portal will follow the Payable pathway already in place. So if we can see from the next slide there, Orla, as you can see, this is the user model for the portal, which outlines the various stages of approval and requester access. The service manager will be a requester, the general manager will be a requester and approver, the head of service will be a requester and an approver, the Payable department will be a requester and approver on behalf of the chief officer and a submitter of job orders to the HR departments. All service managers, general managers and heads of service were requested to register online using the link which has been circulated to all services. It is envisaged that this portal will become available before year end. All staff will have to migrate to Health IRL in order to have access, which will include users of shared mailboxes also. Further details will be circulated to managers when they become available. Thank you. I will now hand you back to Orla.
So I just want to say thank you to Christine for giving us a taste of what's to come when the recruitment portal goes live. We've covered our 4 topic areas. Topic 1 covered hire forms, job orders and the temporary appointments form. Topic 2 covered the Payable pathway, the primary notifications process and organisational management forms OM1 and OM2. Topic 3 covered our HR setup forms HR 101, HR 102, HR 103 and forms HR3 at HR 106. And topic 4 covered the introduction to the recruitment gateway user model and the digital gateway. I'd just like to remind you that slides will be available for circulation after the webinar, and if you have registered with your email address, you will be able to get those from us after the event, and we will circulate those to you.
Okay, so we're just, as I say, just to thank you all for attending today, and many of you have been deeply involved in the recruitment over the past number of months. So just to say thank you for your patience and support as we've kind of gone through this. It has put huge demands on our HR departments and our managers and administration staff. So thank you very much for all of that. We're holding another webinar on the 23rd of June, which is really an introduction to the Enhanced Community Care Programme. It just provides a little bit more detail on the services and an introduction to the operational leads and network managers for that. So further details on the content and the registration will be circulated through your line managers over the coming days. And as Orla has said, you know, this is recorded, so it will be made available, and certainly feel free to share it with your colleagues that were maybe unable to attend today. So just to say thanks to everybody. Have a great afternoon. So goodbye from myself and from Orla, Ciara, Christine and Ciara Rooney, and have a lovely afternoon. Thank you.